Come to the subject that we think deserves a bit of a deep dive today. So on the 1st of July, the United Kingdom reported over 26,000 new COVID-19 cases. It was the highest daily infection rate since the 29th of January. In fact, for the 3 days preceding that, UK had reported over 20,000 cases a day. Now, why are we talking about UK? Because number one, it is the first country in the world to have started its COVID-19 vaccination program. They've already vaccinated close to 50% of their population, 49% actually to be precise, with both doses. And yet they saw a surge of the Delta variant and an increase in infections as well as hospitalizations. It's not just the UK. Israel has also seen an increase in infections over the last few weeks, despite having even more proportion of their population vaccinated than the UK. A tiny island nation like Seychelles has nearly 70% of its target population vaccinated, and they're seeing a spike in cases. So what's going on? What do we understand from this trend, and what is its relevance to us, especially in light of the fact that the UK is now mulling a third shot, a booster dose for people above the age of 50 that they may roll out as early as September. To understand this, I'm joined now by Dr. Rajib Dasgupta. He's member of the National AEFI Committee. Dr. Chandrakant Lahariya is with us today, as is Dr. Ravi. Welcome to all of you, and thank you so much for speaking with us today. Dr. Ravi, let me begin by just getting your perspective on how we're joining the dots here. What we simply want to understand is, yes, we all know vaccinations work, but the general perception is once you get enough people vaccinated, the problem is done and dusted. The pandemic is over. Are the experiences of these nations that I've mentioned showing us that it may not be as simple as that?
Having me on the show, and let me make my points and others can add. First of all, I think the expectation from COVID vaccines has been extraordinary from humanity. There is no vaccine in the history of humanity that can prevent infection. Let me make it very clear, especially viral vaccines. All vaccines available and authorized for use anywhere in the world today protect against serious disease and death. And so does COVID vaccines, irrespective of variants. That is the fact. UK has been seeing a huge surge in number of cases. These are COVID infections. If you actually look at the data closely, the number of deaths in UK due to the Delta surge is in 2 digits. To be precise, it's 99. In this second wave, in December, which they had, where there was a huge surge, the mortality was much higher. The point I'm trying to make is vaccines are not good at preventing infections with new variants that are more infectious. But remember, the immune system has a very important property known as memory. It can respond to any infection after vaccination, and it can give protection. So I think this is going to continue. New variants will emerge. There will be infections, but those who are vaccinated will be protected against serious infection and death. Over.
Is the data backing that up though? Dr. Lahariya, what is your view on this? Because the more infections you have, as a proportion of that, you may still have relatively more hospitalizations and perhaps more deaths as well. UK has also seen a small increase in deaths versus those who are vaccinated, of course, much less. The data shows that. But does it show us that we will continue to be careful? We cannot unmask and go back to, the world as it was before just because we're vaccinated.
So that is actually true, that we know that vaccines can prevent from moderate to severe illness and death, and which essentially the role of vaccine, and that's what the purpose of vaccination program across the world. And that's why we recommend that even after vaccination, the full vaccination, individuals need to keep wearing masks. Now, that's one part, and that's why we need to keep suggesting, advising people to follow COVID-appropriate behavior as long as there are cases and world is in the pandemic. That's one part. Second part is that we need to remember that UK started vaccination somewhere around late December 2020. Now, this is going to, by September, when they are planning a booster or a third shot of vaccine, this is going to be around 9 or 10 months since the start of vaccination program. Now, if we go by the existing knowledge and current understanding, that we broadly believe that the protection after full vaccination is expected to last, or for around 80 to 90% of population will be protected for 6 to 9 months. So we will develop some understanding that a vaccine immunity will wane off, and definitely people would like some additional protection, protective measure to prevent from moderate to severe illness also. What we have also learned over the period of time that the emerging variants require higher quantity of neutralizing antibody to work, to vaccines to work, and that. And there is another study which was released by Oxford Vaccine Group, which found that if a third dose of vaccine is given to the individual who received 2 shots of vaccine, after a gap of 6 months or even longer, the individual are likely to develop an even higher amount of antibody. So putting the operational, epidemiological, and scientific knowledge which we have developed till now, I think it's very logical that some point of time, especially in respiratory illness, people might require some boost to their immunity, factoring in the emerging variants also. So I think all of this is very logical. But I would also finally would like to reflect about India, that I think the case of United Kingdom is very different from India. United Kingdom has vaccinated around 80% of their adult population with at least 1 shot of vaccine. Now, India is very early stage, so this is not applicable to India as of now, and we can easily go on till early 2022 with the ongoing vaccination program. But this, we should also keep a watch on what other countries are doing, because those learnings will provide important lessons to tackle how to roll out vaccination, how to scale up, and what additional should be done in the country. So this is important. We need to keep learning. UK is different, India
Exactly.
is very different, but this is helpful.
Yeah. No, which is why have we taken the example of UK? Because it's the first country in the world to start its vaccination. It's vaccinating largely with AstraZeneca, and we are vaccinating largely with essentially the same vaccine with the name of Covishield over here. Dr. Rajib Dasgupta, your views on what we're seeing in UK, and are you concerned why are we seeing an increase in infections despite a very decent level of vaccination having been achieved? Isn't this the stage at which herd immunity should now take place?
Well, both Dr. Ravi and Dr. Lahariya has made extremely pertinent points, and I'm in full agreement with what both of them said. However, to add a little bit more perspective, the UK and several other countries in the world, both in Europe, USA, as well as Africa, are now actually encountering the Delta variant, which has taken its toll in India in the ferocious second wave that we just about survived. So they are now faced with a new epidemiological challenge, and that's what we're essentially witnessing there. When the vaccines were actually being discovered and designed and operationalized into the program, that was a period of relatively what's called an evolutionary stasis, which means that there weren't too many variants emerging at that point last year. And therefore, some of the extra hope and hype around the vaccines. But then, as Dr. Ravi very, very correctly explained, there is a bit of extra hope and hype, particularly given that it's an adult vaccine and it's a viral disease. So to that extent, the situation in the rest of the world is somewhat different from where we are placed in India now. The challenge for India at this point is getting the second doses, which is now plateauing a bit, both in the 60 plus as well as the 45 plus age group. The coverage with a single dose in the very, very large 18 to 44-year age group is now about 30%, and that's a single dose. And this really is the population, which is the working population, which is the student population. And we need to get back the economy and human activities into shape. So the vaccination program in India will have to keep gathering more steam. But then, as Dr. Lahariya said, we need to watch and learn from the other countries. But then India is not really in this particular predicament now, though of course almost everything is very, very global now, and therefore what happens in the rest of the globe does have a bearing on many Indian activities and sectors.
No, so Dr. Dasgupta, specifically in the Indian context, what is being seen in a lot of these countries that we've mentioned is the resurgence of the Delta variant challenging the coverage and the protection that the vaccinations there have been given. In India, we've already got the Delta variant all pervasive. The estimates that about 98% of our cases are Delta variant cases. So does that in a sense save us from a worse third wave? And this situation where people are vaccinated, our vaccination coverage improves dramatically, but infections then continue to rise?
No, I would not jump to linking these two issues. When and to what extent we will have a third wave will be informed, at least in part, by the sero surveys that the Niti Aayog and the government of India has decided that the ICMR will undertake at the district level. So that will give us some idea, I mean, as and when these results are available, of vulnerabilities at a more decentralized level, which is the district as a unit. However, a case in point, for example, is the South African experience. So what essentially happened in South Africa early on, we know that the earlier phase of the surge in South Africa was the Beta variant. That at that point they did not actually get on with the using the AstraZeneca vaccine for immunizing their population. Though the advisory, the global wisdom at that point was that you start the vaccination so that you can protect from severe disease, from deaths, from hospitalization as other variants may emerge. And this is what exactly South Africa is facing now in one of their small but very highly populous provinces, which is also the industrial and financial heart of South Africa, where now that South Africa is really low on vaccination, many South African experts are actually mulling over whether that was a correct decision at that point. And I think India did well to be keeping up with the momentum of vaccination, and I hope this serves us well.
Yeah. I want to understand whether we're going to need a booster shot eventually as well, and what are the implications of that. Dr. Ravi, if the United Kingdom and maybe other countries start giving third booster shots at a time when a lot of the globe has not been able to get even a single dose, what kind of inequalities and issues does that give rise to?
Tamanna, I would like to reiterate what the other two panelists said. What Dr. Chandrakant said is very important. At this point of time, a booster is irrelevant to India, in my opinion. I know I'm very strong in my opinion. That is because our aim should be to get as many people vaccinated as possible, at least with one dose. Even in UK and many other countries, data has shown with one dose also you can bring down morbidity and mortality to a great extent. And as far as possible, we should achieve 2 doses. We are aspirational that we will be able to do it by December. Hope we will be able to do it, that at least a large proportion of adults have covered. Now, having said that, when do you think a booster is required for India? I think these are early days. We know that vaccine immunity lasts at least 9 months. So I would worry about a booster for India only in the first half of next year, provided we meet our targets. I must also tell you that there was a very nice study conducted by National Institute of Epidemiology, analyzed data from close to 70,000 police personnel, which is a closed cohort and community, and they found that in people who have received one dose, 85% did not have serious disease or death. In people who have received two doses, 95% did not have serious disease or death. I think that is very, very encouraging in my opinion. So getting a large proportion of people vaccinated should be our target. I think boosters, as Dr. Chandrakant said, we'll keep that in the radar, but it's too early to talk about boosters for India. Let's get everybody at least one dose, if not two doses. Over.
Yeah. No, I'm not for a minute saying that India now needs booster shots. We've not managed to get everyone one dose. I mean, we're vaccinating at a decent pace, 38 lakh jabs today, but our aim is 1 crore. So we have a long way to go. I'm trying to understand the trajectory of what is happening around the world. Because remember, in many countries of the world, they had managed to vaccinate because of smaller populations. A bigger proportion of people had let down restrictions almost completely and thought that COVID was over. They are now seeing a resurgence. In fact, let's listen in to what Dr. Tedros of the World Health Organization said today.
But no country on earth is out of the woods yet. The Delta variant is dangerous and is continuing to evolve and mutate, which requires constant evaluation and careful adjustment of the public health response. Delta has been detected in at least 98 countries and is spreading quickly in countries with low and high vaccination coverage. There are essentially two ways for countries to push back against new surges: public health and social measures like strong surveillance, strategic testing, early case detection, isolation, and clinical care remain critical, as well as masking, physical distance, avoiding crowded places, and keeping indoor areas well ventilated are the basis for the response. And second, the world must equitably share protective gear, oxygen, tests, treatments, and vaccines. Finally, some countries, regions have launched so-called vaccine certificates, and I want to make it very clear that it's important that these do not lead to discrimination against those people and countries that have either a lack of vaccines or certain type of vaccine.
So, that was another important point Dr. Tedros was making. Don't discriminate against people who've got certain vaccinations, which was what European Union was doing for Covishield before there was a hue and a cry, and some countries have rolled back. But that's a different issue. Dr. Lahariya, I want to come to you, as we wrap up this discussion with a very specific question. Will it be safe to assume that if India manages to vaccinate its adult population or most of its adult population by the end of this year, then we can see an end to the cycle of more waves? Can we say that at this point, looking at what's happening in some of these heavily vaccinated countries?
So as we are learning from other setups that while they have achieved a high level of vaccination coverage, at least single shot, be it Israel or United States or United Kingdom, there is a rise in the infections, and which is a real proof that vaccination can definitely help in reducing hospitalization and deaths. So in those countries, the hospitals are not overburdened as they were before vaccination programs. But we are seeing the rise in the infections. We are also witnessing that countries are deciding going back to the masking. Like Israel had removed the mask mandate and now going back to masking to prevent the infection. And this is really telling that till the pandemic is over from all parts of the world, till the virus transmission actually halts in every part of the world, we cannot consider ourselves safe no matter what level of vaccination coverage is achieved in one particular setup. That's one part. And quickly, the last 30 seconds, second part, that I personally think that India cannot achieve the full all-adult vaccination by end of this year. It will take a little more longer than that, and which essentially means till mid of somewhere 2022, India would be at that stage. But India also should show leadership, as you are flagging other issues, that UK and other countries, before going for a booster shot, countries should be looking at global solidarity to ensure that vaccines, at least one shot of vaccine, reaches to people who are getting affected. And that's how we can be assured that we will be safe, no matter whether it's India, UK, Africa, or any part of the world.
You know, the hesitancy to continue looking at this as a global problem may get us stuck with this pandemic for longer than we hope to. Thank you so much for joining us on this discussion, and all of our experts for explaining today how a booster shot may be a reality in UK today, but there's some time before India has to look at that option. We'll take a very short break here, but our special reboot programming coming up next. Stay tuned.